Hi, I'm Dilshad Patel and I'm a movement therapist. I have been an Indian classical dancer since I was 5. So I was a Bharatanatyam dancer and I did it professionally for about 12 years. Whilst doing my dance training, I was working at a non-profit organization. However, over there I met a social worker and she advised me to look into the field of movement therapy, and that's where I got my idea. I've already taken it to hospitals. I've done a few workshops at Asian Heart Hospital with a few heart patients under the guidance of Dr. Ashish Contractor. I've also done, I've been fortunate to have gotten the opportunity to conduct an experimental pilot study under the aegis of Dr. Farooq Udwadia, as well as Dr. Khyati Mehta, Breach Canning Hospital, where I conducted a study, of experimental pilot study, where there were 12 90-minute sessions for 15 patients, and the hospital sponsored a few tests. So we did the PFT or pulmonary function test, we did the 6-minute walk test, we did perceived stress scale, which was a 14-digit perceived stress scale, and of course the health related quality of life test, which was compiled by the authorities at the hospital. And through those tests, just to sort of help patients navigate through problems and issues that cause, triggers that cause the asthmatic attacks to begin with. We're talking about the psychological part here. We saw massive improvements. So everyone reported improvements in the 6-minute walk test, obviously because they were going through constant motion and exercising, and a lot of change happened over there in that aspect. However, in the perceived stress scale, everybody noted psychological improvements, and overall, it was a success story because two patients noted that they didn't feel like taking the evening dose of medication. Now, although as a movement therapist, we cannot administer or not administer or interfere with the medical treatment that is going on with the patient, it was something to be noted that patient would feel so strongly and so much more confident in the body, resulting in health-related quality of life. I have once again adapted the basic tenets of movement therapy for sports, where I've created and developed the movement therapy for sports training method, which has been implemented by the Rajasthan Royals, the IPL team, the Rajasthan Royals, for 2 seasons, for IPL 3 and IPL 5. And I've also worked in conjunction with World Cricket Academy with the Canadian cricket team for the World Cup in 2011. Now, what movement therapy for sports is a training method for sports optimization, where you give a player a stronger sense of self-concept and self-awareness. Therefore, once he has addressed issues that he is facing on and off the field, he's more whole, socially, mentally, physically, cognitively, and emotionally, to face the audience when they're playing a certain match. So we're not only working on fitness elements, we're also working on psychological issues. We're also working on honing the emotional release of the player, and thereby making the player completely whole. So in conjunction with the coaches, the physios, the physical trainers, and mental health coaches, something like this has been adopted for 2 seasons because they then see the players function differently, their team bonding is different, their cohesiveness is different, their understanding and in timing of quick responding to each other is different, and that's what the MTS training method is all about. Cricketers in general are a little apprehensive when they start anything new, any new coaching program. However, because of the practice sessions and because of constant working with the cricketers, they kind of adapt, and they know exactly that there is this is going to put value onto their game. So the minute there's value that they see, which has been wonderful, it's only through experiential knowledge that they then are able to sort of understand the concept of what movement therapy for sports is. Vision for the future is to train people to carry out the work, and effective training is very, very essential and key. To have quality training is something that I wish to propagate, and then Another vision that I have is to train coaches in the MTS method to sort of then be able to spread the word, and people can carry out the work more effectively.